Gentlemen, thanks for joining me today. I wanted to kind of just have a small discussion about men's health. You know, we do have Men's Health Awareness coming up here soon, and wanted to kind of talk about this topic because I think it's something that we all see on a regular basis as we're, treating our patients. But I think it's helpful to kind of get insight as to how patients feel about these topics that often come up in these visits. And I think having your insight and perspective into that is going to be really helpful. So I guess we could start with a very common question that gets asked a lot, and I don't know that we have an answer, but maybe we can just share our ideas, and that's, why don't men come into the doctor?
I think a lot of it has to do with the stigma, maybe depending whether cultural. The most common reason I hear is because they don't want bad news, right? They don't want to come in and find out, God forbid, they have cancer or they have to take medicine for diabetes or high blood pressure. I think it's maybe a little bit of that uncertainty, what they're going to be told is the reason they don't come in.
Yeah.
On top of that, I think it's just like, nothing's wrong. Like, I'm fine. Like, I don't have any issues. I don't have any symptoms. Like, nothing's going to happen. I'm okay.
Yeah.
I think that's one of the reasons, though.
Do we think that maybe we don't do a good job of providing that education to our male patients to say, like, hey, you still need to come in. It's still important I see you. Do you think maybe we need to do a better job of that? Because I'm hearing you, Parm, say, well, I don't have any symptoms, so why don't you go in? And I think that's true for a lot of men. They probably feel like, well, if nothing's bothering me, why am I going to go in? Hey, I only take my car to the mechanic when the oil's leaking or there's, an issue with the car. So, maybe that's something on us that we need to be more mindful of, perhaps that perception on patients' part, and provide some additional education for them and say, well, here's why it's important. What do you think?
I think maybe it's a societal issue too, because you hear a lot about breast cancer awareness, pelvic cancer, and along those lines. Not really so much for men. You don't hear too much about prostate cancer or other, important health concerns. You just don't really hear that out in the media and in culture in general.
Yeah.
And I think education will go a long ways, just because a lot of the diseases and things that we see, like hypertension, diabetes, again, a lot of patients are asymptomatic, so they're like, I'm not coming in. Whereas if we kind of talk to them about, diabetes and these things can go for long terms without showing any issues, but it may be too late, or irreversible complications when you get to that point.
Right.
So just getting that out there and kind of letting patients know about that.
Yeah. So I think if we were to ask that question, why is it important for men to come in? I think the answer would probably fall along those lines of, there could be developing conditions that perhaps don't have any presenting symptoms as of yet, but they're things that we can start to investigate for and catch at an early time before things become too advanced. What would you guys say? I mean, if we were to ask that question, well, why? Patient says, well, why do I need to come in? I don't feel anything.
Yeah, I think just like Parm mentioned, educating the patient on possible outcomes if you don't come in, and what that may mean to your health. It may be serious, maybe not, but I think those important discussions guys need to have frequently with their healthcare provider, and just be open up about the concerns.
And maybe that's something else, and I don't know if it is necessarily cultural or societal, but I think that there's that stigma that men tend to feel that we're a little more invincible, and it's not going to happen to me. And but maybe as providers, again, opening up that discussion and helping our male patients to feel comfortable about some topics that sometimes can be very personal or uncomfortable. I know one of the topics that often comes up in these visits, and it's often oh, by the way, doctor, as you're walking out the room, you got your hand on the doorknob, and it's and that's on erectile dysfunction. And it's a very real problem, right? And but for the most part, our male patients struggle with how to raise that topic and how to seek treatment for it. What are some of the ideas, suggestions best practices that you both have when you're trying to take care of these patients with this specific type of concern?
For me, I like to, I don't want to say downplay, but I like to let the patient know it's very common for men to go through this. A lot of times I feel the patient is embarrassed. I think a guy will kind of perceive it as, well, I'm not a man anymore. I can't function, for my wife or for my partner. But I think just being open up about it and just to reassure them that there is treatment for it, and the outcomes, that are in their favor. But again, just reducing that stigma, like you said earlier, and education.
I think we could do like a little bit better job of maybe making it a little more private, because a lot of times if I'll have a patient, I'll have a translator in with me, and they'll wait till the translator leaves and then they'll, talk to me about it. So maybe if there was some kind of like paper format, like they have some kind of questionnaire that they kind of just fill out, and then I'm able to see it, and then I can talk about it whenever.
Yeah, I think it's a great idea actually that you bring up, because I know for a lot of our female patients, when they come in for their well woman exam, they're coming by themselves, right? They're not usually accompanied by anyone else. Whereas, I don't know about you guys, but for me, when there's a male patient, they're usually there with their wives, and it's usually because their wives brought them into the appointment, And so they may not feel so comfortable about raising that topic up. So, maybe we come up with a different way of raising that topic, whether it be a form that they fill out while they're in the lobby or waiting area, or something electronically they can fill out on their patient portal. But it may be a way for them to comfortably, confidentially bring up a topic. And then what we can do is normalize, is what you were talking about, is normalizing and saying, hey, this is actually a very common problem, And because I tend to do that as well with patients. As soon as I see that they're starting to feel comfortable, as I say, you know how many patients I treat like this every day. It's not just you. It's a very common issue, and there's there are options for it. So very good suggestions. I think a topic that they probably feel a little more comfortable bringing up, that often comes up, has to do around PSA, the screening for prostate cancer, and I think, in part because maybe there is a fear or concern about developing cancer, but also maybe they're fearful that that's what their erectile dysfunction is tied to. I think there has been a lot of communication in the media surrounding PSAs, and that, we've kind of gone in two different directions over the last couple of decades in terms of PSA testing and such. So how do you guys handle when patients bring up this question about should I be getting my PSA checked?
I kind of bring up like family risk factors, family history of prostate cancer, the patient's age, whether they're having any symptoms. And I think just letting them know beforehand that, just because if we test a PSA and it comes back a little elevated, that's not uncommon to see with like different things. That doesn't mean it's, cancer or anything like that. And we have to let them know that, we use the PSA in conjunction with the digital rectal exam to, solidify something. And then even then, if those are abnormal, we're still probably going to send out to urology, do some imaging to confirm things like that.
I use a very similar approach as Parm. Educate on the possible causes of elevated PSA. Maybe they had a recent viral, common cold, and it brought it up. But just educating the patient on what PSA actually means and what it means when it's high. I found to be beneficial, and puts the patient at ease too. Because again, you said they're used to correlating a high PSA with automatic cancer.
Right. Well, and I think that highlights, the importance of us being able to distill for them information that may be out or outdated, and be able to say, well, this is the latest recommendation, and this is why, we test or don't test, or in which scenario we would or would not. I think that's important. Oftentimes, as I'm talking with my male patients about PSA, I often will use the opportunity to also bring up colonoscopy and colon cancer screening, since they're kind of tied to one another. And I often get a response from men saying, "Absolutely not. I'm not going to have a colonoscopy." How do you guys handle when there's any sort of resistance to doing a colonoscopy for colon cancer screening?
So I always kind of present them with their options. So we have every 10 years we can do colonoscopy, or we can do the fecal occult, which is going to be once a year. But then I also kind of let them know that, if it comes back positive, you're likely going to need a colonoscopy anyways. And I've seen a lot of patients, when they kind of understand that information, they'll opt for just going for the colonoscopy and getting out of the way.
Yeah, generally that's my experience too. Bring up the fecal occult test and its benefits and its use. But yeah, being open about having a positive result does mean you won't need a colonoscopy. And I also educate on family history. If they were high risk, I just lay it out for the patient and say, you're a high risk for developing colon cancer. I think it's very prudent for you to go get tested. And usually it works for the most part.
Yeah.
Most part.
And then sorry.
No, go ahead.
I was just gonna say, and also like conveying that the reason we check for colon cancer is because it's common, and if it's caught early enough, it's treatable. Versus if you're showing symptoms, again, it goes back to I'm not showing symptoms. So,
Yeah.
So,
Right. Yeah. Again, it sounds like providing the appropriate education for patients so that they understand that while we may encourage a colonoscopy to take place, that if they're absolutely against having that there are other options that exist,
right.
and a simple stool test that they can even do out of the comfort of their own home and put in the mail and send off to the lab is sufficient, although it may not be what we encourage or recommend. So good. Another question that I think tends to come up quite frequently, and maybe a lot of it is because of what is in advertisements and magazines and such, is testosterone deficiency and treatment. So how is it that you guys handle when patients come to you and say, can I get my testosterone check? Or, hey doc, can you inject me with some testosterone?
Yeah, I mean, I like to educate again the patient on the risk and benefits. Us providers know that medically may not be a good idea to be injecting people with hormones because it increases your risk for prostate cancer and other cancers. But I like to educate the patient on what it means, and also like to educate the patient on other causes of why they're feeling fatigued or why is their libido down. No sex drive. Maybe it's stress related, not so much a hormone thing.
Right. Yeah.
I would agree with that. And then again, as we age, like testosterone level decreases too. So kind of let them know too that if this comes back low, that doesn't necessarily mean it's low. It could be lab error, different things. We're gonna have to retest and evaluate further. But I think evaluating for other causes, like more common, like thyroid disorders and things like that, before going down that route.
Yeah, another important reason why we would encourage men to come in on a regular basis and get evaluated, because we may be able to capture something like a thyroid dysfunction or other condition that may be contributing to a lower libido. And you pointed out something that I think is another area where we as men struggle with, and that's in the area of mental health. I think that as men, we may not often recognize that the symptoms we're having could actually be a behavioral health condition. It could be stress, it could be anxiety, it could be depression. How do you broach that topic with your patients when you might have the occurrence to see them for this?
I like to approach it again, like it's a common thing to go through, especially right now with the pandemic that's going on. This is very high right now. Anxiety and stress, depression is really high right now for a lot of people. I like to offer them our resources at Camarena, our behavioral health, and just offer different resources to cope with their stress and anxiety. I think, my experience being open about it and listening to the patient and their needs, they usually respond to following up with behavioral health.
Just letting them know that if they don't feel comfortable talking to me, there's always behavioral health. There's another provider they can talk to that they may feel more comfortable with, and just letting them know that we have other options to help patients. And again, it's common, like depression, anxiety, these things we see all the time, right?
Yeah, as you said, especially in a time that we're going through right now with this COVID-19 pandemic, there's the obvious health risks that are present with acquiring the infection, but then there are the other impacts that the pandemic has on your financial situation and your mental well-being because of concerns about job loss or other things. And so I think normalizing it and saying, hey, how are you feeling? How are you doing? This pandemic's a rough time to go through. How are you holding up with this? And as you said, Parm, if that's something you're not comfortable talking with me about, can I refer you to someone who's trained in being able to have these types of discussions? And you can have you see my colleague in behavioral health. I think that's certainly helpful. Are there any other topics, any other things that you've noticed come up in men's health visits that maybe we haven't talked about, you guys can think of? Or
I think we covered most of them, but again, just the annual screening is a big one.
so coming in
It's
for a
just
physical,
coming in for a physical,
even if you
yeah.
feel fine, you don't have
Yeah.
any symptoms,
Yeah,
but coming in and getting checked out, making sure everything's working.
yeah. I like to tell my patients at least once a year,
Yeah.
minimum once a year.
Yeah.
That we can capture something or just check up and see how you're doing
Mhm.
in general.
Yeah. So I guess like if I were to summarize some of the highlights of this discussion, it would be encouraging regular annual checkups with the
Mhm.
provider. For ourselves as the medical health professionals, it's providing the appropriate education, creating a welcome environment,
Yeah,
right? And normalizing as much as we can some of these topics that can be very sensitive and difficult
right.
to discuss.
Yeah, and just offering all the resources that there's resources for whatever they may be going through.
Yeah.
We'll get you plugged in where you need to go.
All right.
Yeah.
Well, thank you, gentlemen. I think we're all
All
going to
right.
go schedule our annual
Physical?
physical. Yes.
Yeah.
All right. Thank
Yeah.
you.
All right.
Okay.